Other things can be hereditary. So sometimes you get people who are born with actual weak bones. You have the genetic problem with the collagen is not normal, and so they end up being very brittle and they fracture quite easily. You get other things. So sometimes it can be other conditions that predispose you to certain issues. So something like HIV can predispose you to have it's not a very common issue, but something called AVN of the hip, where the blood supply to the hip gets affected. But often it can be related to the medications that you'll be treated for your other medical issues. Or it's one of the side effects. It can be a side effect. And then you get to occupational hazards. So people who do certain sports or certain activities, like the same thing, but as when earlier the AVX, deep sea divers are at higher risk because of the pressure changes can affect the way the blood is suffuses to the hip. So there are certain lifestyle factors, there are certain medical issues, there are certain droughts that can affect your body health. But these are so varied that it's hard to give you a short list of things.
Yeah, I wanted to ask if is there a way that we can actually someone can go for screening for bone conditions?
Yes, I think it's such a broad term to say bone conditions. So I don't think that there's routine screening for all the bone conditions, but in terms of bone density, if someone is worried about their bone density for a particular reason, then you can do what we call a DEXA scan, which is a special set of x-rays that allow you to assess your bone density. This is usually recommended for our old patients or patients who have what we call a no integer factor, where with a small trauma, they end up with quite a significant injury. And if you do this and test your bone density, that will allow you to see if you need treatment. So if